You know the McKinsey Institute's interest in warfare, the Cold War, global tensions, and public security. But what if I told you that more people died in industrial accidents in World War II in America than on the battlefield? What if I mentioned that more people in World War I died because of the Spanish flu than on the battlefield? In fact, I think about 60% of the French army was in tents, in hospitals, not in combat. We don't actually know how many people died of the Spanish flu. The official estimates are supposedly 50 million, but I think it was more like 100 million because the flu virus wasn't even isolated in a lab until 1933, and many of the cases weren't diagnosed. We were cramming troops into crowded ships and barracks, and that spread the disease. Well, now we have hand washing and we have public health initiatives that are going to mitigate, but we are still supposedly due for another pandemic. Now, how do you get due or overdue for a random event? That's a tricky question. But certainly the World Health Organization is estimating that 350 million people might die in a future pandemic. Hard to tell because of all those changes in sanitation and so on. But for this Throwback Thursday, let's take a look at pathogens and pandemic planning. Hello, I'm Allan Bonner, and welcome to At Issue. Globalization, climate change, and our resistance to drugs have come together to set the stage for the perfect microbial storm. A wave of disease could kill millions before we can react. The disease could be another HIV, or smallpox, or Spanish flu. Once a killer disease emerges, modern societies offer new ways for it to flourish and spread. Global travel, crowded urban environments, and people at high risk can cause the toll to rise. The question is not if the next killer disease will emerge, but rather when it does strike, will we be prepared for the devastation that comes with it? You know, we talked before you decided to come on the show about the potential for scaring people. That could be good if we scare them into doing the right thing. But media people are often accused of being alarmist. So help me out here. Take a free 1 minute at the beginning of the program and put this topic into context so that I'm not confused or accused of overreacting.
Well, I think if you look through our history, basically since we evolved, there have always been waves of infectious disease coming through, and we probably have gone through a really weird period in our history, the past 100 years, where we haven't had sort of a big, huge problem come through. So that it's not a question of if, it's just a question of when. And I think making people aware of it and explaining it to them in a logical way allows you to understand the problem better and therefore react better.
Okay, now statistically, you're saying we are due for some kind of pandemic or wave that goes through the world, and you are 100% correct. However, let me point out that the flu virus wasn't even isolated in a lab until 1933. We didn't even know what we were looking at. Scientists during the pandemic in 1918 thought dirty books spread the flu. Today we have sanitation, we have hand washing, we have a whole different way of living. So could we really be safe in predicting that we are going to have something?
Yeah, as I said, if you go back historically, and we're overdue. And it's because essentially we're awash in this sea of pathogens, germs, bacteria, viruses and things, and they're changing, we're changing, and it's just a matter of time till things click. And you have a next sort of widespread wave, I guess, of a particular pathogen that comes out and causes problems.
Well, let's talk about lab people for a second and people who wear scrubs in hospitals. In the folds of those scrubs, I am told, are microbes, and they are in sick people's rooms. And I see these people at the donut shop having a cigarette on the street, on the transit. This is malpractice or something, isn't it?
No, it is. I've seen this happen, and I saw this happen during SARS, the SARS epidemic. I saw people coming in their scrubs with their masks on their heads, stethoscopes around their necks, coming out of the hospitals
Are the dirtiest things, the things with the greatest number of microbes on them in hospitals, still physicians' ties and physicians' pagers?
Yeah. Basically the problem with the hospital is you take every sick person, you concentrate them together, you then get people who walk from one person to another, It's estimated that a person in the hospital will be touched 60 times every day by one person or another.
And then another person.
Yeah.
It almost appears like physicians are still fighting the germ theory as they were 150 years ago. Why won't physicians wash hands?
One simple little factor, they're human. Humans can think through something very logically. When it comes to doing something, they do it a couple times and feel really good about it, and then suddenly they go back to their bad habits.
Christian Barnard's brother, the famous heart transplant surgeon, he said the two things that would improve human health the greatest in all of the world are washing hands, brushing teeth. Is that still true?
I would agree with that.
Okay, so the World Health Organization is back in the anti-malaria business. Bill Gates is giving a lot of money. The U.S. has devoted over $1 billion. Are they going to succeed?
Well, yes, maybe yes, probably no. These diseases have been around a very long time. They're very complex, and actually Bill Gates was the first person who came along, and even if he put in $80 billion with a B, if you think about it, it's a huge problem, and that's just the start.
I hear of people in Canada's north looking for the accidental death of birds just in case that's a distant early warning of a bird flu. That's a good idea?
Yeah.
Are governments doing enough?
The problem with governments is that people want whatever the issue at the moment is addressed. So it's very difficult to try and stay on top of things.
There you sit working betwixt and between hospitals and a university and a lab among scientists and smart people. Are they prepared?
They're coming to the point where they're starting to get prepared. One of the things about a pandemic is it's like the financial business we've been through in the past 6 to 8 weeks, where it suddenly shows up, and with hindsight, there are all these things you should have done, but you never quite got around to them. And your point, one of some interesting points, is that the way you manage healthcare effectively in Western countries is you try and match the amount you have to the average load. And if you have a pandemic, that average load suddenly is way too, it falls short, basically, what you need. So the whole idea of suddenly people wanting to get hold of drugs and rushing to hospitals is actually...
Or rubber gloves.
Rubber
or
gloves.
Tongue depressors, or really mundane stuff.
Everybody running out to the home supply place to get the mask, whether it works or not. I mean, it's simple things like we don't really know if those masks do stop influenza.
Is there somebody in charge of getting all those people off the highway that are clogging up the roads, trying to get out of the country, to allow medical supplies to get in a truck down the highway? In other words, who's in charge of making the system work in a pandemic?
It's been an interesting experience in Canada the past 10 years. Essentially, you have various levels of the government, and frequently they assume that another level, it's their responsibility, their jurisdiction. So when we've had interesting things show up, essentially it's the person who takes hold of the situation, then becomes the de facto commander in the field, which we've been fortunate so far, but could easily turn out to be a disaster.
And you can't convene a federal provincial conference and bring in the municipalities when a pandemic hits, because by the time you do that, people will be dead.
Yeah.
I'm Allan Bonner. Thank you for watching. A few final thoughts on pandemic planning. It is said by some emergency planners that terrorists would be better off spraying the flu virus around a shopping mall than planning something more elaborate. It would take a lot of people out of action for a long time. Take a look at our hospitals. How many people walk out of the hospital in their scrubs? These are what used to be called orderlies, but they're nurses, they're doctors, they're others. And one of the dirtiest things in a hospital is a physician's tie. They've been long banned in England. Another dirty thing is the pager and the lab coat, which don't get washed often enough. There is a lot we can do in pandemic planning. What can the individual do? Wash hands. Keep a social distance away from people. Don't get on crowded transit if you're sick. And stock up what you need. You may not want to leave the house. Any views expressed here are not necessarily those of the Mackenzie Institute, its speakers, sponsors, or supporters. But the Institute is dedicated to fostering public discussion, debate, and education about security matters. Google the Mackenzie Institute to join the discussion. The Mackenzie Institute is grateful to its sponsors and supporters. Some of our short pods and long talks are a result of the support of Heathbridge Capital Management Limited, the National Post, and Dundurn Publishing.